Pregnancy can be really painful, in case that's a newsflash for you here at the Pregnancy Nurse. But today I want to tell you some of the most common pains of pregnancy and some of the most likely fixes for you. So I'm glad that you're here. And yes, these are things that I saw in my 20 years in labor and delivery. We see lots of patients in triage who are just in a ton of pain, although it should be something that you bring up to your provider at your regularly scheduled appointments. Or if you are in a lot of pain, they should be willing to see you in the office for an extra appointment, because increased pain that is new or different should be something that they take seriously. Now, I do want to say that just because they should take it seriously doesn't mean that your OB has the fix for all these different kinds of pain. Sometimes they have to send you to somebody else, so that's something to be aware of right off the bat. And one of the biggest pains of pregnancy is that you got to get ready for all of it. I actually have a third trimester checklist that I'm going to link down below. It has so many good resources. I think you guys are absolutely going to love it. And this video is actually based off of a post on my website. I'm going to link that post down below as well. It has a little bit more information than the video. Okay, one of the first pains of pregnancy is heartburn pain. One of the first lines of defense for heartburn is Tums. So these are calcium carbonate. They're sold over the counter, and you can take them safely for heartburn during pregnancy. Although I think you're only supposed to take a certain number every day. So at your next prenatal appointment, talk with them about Tums, how many you're taking, if it's okay, and things like that. However, if you are taking a lot of Tums a day, there are other medications that they can give you for heartburn. So talk with your provider about those different medications and see if one of them is right for you. Heartburn in pregnancy is not unusual, because as that uterus grows, it tips up on the stomach and makes it so that acid from the stomach more easily comes up into the tube that goes towards your mouth. It's a super annoying but not uncommon part of pregnancy, but there should be things that can help you. In the hospital, we actually have like a cocktail that we give people that includes, I think it's Maalox, Bicitra, and maybe something else. But it really soothes the heartburn, but tastes absolutely horrible. So talk with your provider. The next one is pelvic pain. This pelvis gets a lot because you got to think baby is growing inside of this pelvis. And so it just gets a lot of pressure. This is called your symphysis pubis, and it's actually not bone. It's a stretchy bit of material that's sort of like your nose, that as baby grows and it starts to stretch can cause a real problem. It's called a symphysis pubis. I actually have a whole video on pelvic pain that I'm going to link to down below, because it's kind of its own special brand of torture. So definitely watch that video if you're interested in how to fix your pelvic pain. But I am here to say it is a very normal part of pregnancy. It cannot always be fixed, but your provider should be doing things to help you with it during your pregnancy. The next one is cramps or Braxton Hicks. These are contractions, and they can hurt quite a lot. And you may actually think that you're going into labor. I actually have a whole video on false labor that I'm going to link to down below. But a lot of people are like, oh, they don't hurt very much. But I'm here to say that cramps and Braxton Hicks can hurt quite a bit. You know, it still can be painful. Make sure that you're drinking enough water and watch that video if that is a problem for you. One of the next biggest pains of pregnancy is just waiting for like test results, making sure that the ultrasound's okay. Honestly, just waiting for that positive test. And there's a lot of waiting and seeing during pregnancy, and that is one of the biggest pains of pregnancy. And I literally have nothing for you other than my heart goes out to you, because just waiting is not very fun. Waiting for labor, I get you. Waiting can be one of the biggest pains of pregnancy, even if it doesn't have anything to do with your pelvis. Now, back pain can be a big part of pains in pregnancy. You know, as you start to grow your belly, your back has to accommodate by keeping you upright, even though you're holding a watermelon in front of your body. So backs take a lot of pressure during pregnancy. I think it's important to make sure that you're doing stretching. If the stretching isn't working, maybe go and see a physical therapist to give you ideas for you and how your body is working. I think it can be really helpful for the back pain in pregnancy. And I'm here to tell you, it could also be helpful for back pain postpartum. So making friends with a good physical therapist can be really helpful during pregnancy, because you probably are going to want to use them postpartum as well. Now, one of the other things that sort of feels like pelvic pain, but it's more in your abdomen, is ligament pain. And I actually have a whole video on ligament pain that I'm going to link to. But your uterus is sort of tied into your pelvis with these things called round ligaments. And as your uterus grows, which can happen honestly early in pregnancy, mid-pregnancy, I feel like we get bouts of this during our pregnancy. Those ligaments stretch and they feel very angry, which in turn makes you feel very angry. So there are things that you can do to make them better. Again, a physical therapist can help you with those, but your provider might give you some ideas in the office. And then if those aren't working, then seeing a physical therapist would be helpful as well. But you got to think the uterus is sort of tied into your body at these specific points. So a lot of times sometimes you'll feel them down here, up above, and usually that's ligament pain. But again, if you are having new and painful parts of pregnancy, be sure and mention it at your provider visits so that they can go through and make sure that nothing's wrong and that everything is progressing well. Now, the last, and I would tell you biggest part of the pains of pregnancy is having the baby. And so 60% of the American population ends up getting an epidural, but there are other things that you can use. Natural pain management. I actually recommend that everyone get some natural pain management during their pregnancy. Honestly, it can really help with all of these different pains. Sometimes you will get a doozy of a ligament pain that is just as painful as contraction pain, and learning to breathe and relax into it actually helps the ligament pain go away rather than tensing up, which could actually make it worse. I swear, Mother Nature is not on our side in this foray, but learning natural pain management can be super, super helpful. I have a birth class that I recommend that both teaches natural pain management, but also helps you to know what's going to go on in the hospital and how to make the best choices for yourself during your labor. I'm going to link it down below. Now, for a lot of people, they just feel like all of pregnancy is very painful and they feel like it's unfair, like their partner doesn't have to experience a lot of the pains of pregnancy. And I'm here to tell you that that is 100% true. It isn't fair. Pregnancy can be very difficult and my heart goes out to you, but the good news is it doesn't last forever and soon it will be done. And I cannot tell you how happy people are when they're no longer feeling those ligament pains or their back gets to go back to normal rather than having to accommodate for their big belly. Now, I have a whole video on the sharp pains of pregnancy that I'm going to link to up above. I think it's going to be really helpful and it explains a little bit more about the anatomy and how all of this goes on. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.